Hi, my name is Stephanie Blank, and I'm the Director of Gynecologic Oncology for the Mount Sinai Health System. Ovarian cancer is cancer, which is abnormal growth of cells, which arises from either the ovaries or the fallopian tubes or the lining of the abdomen. Now, the ovaries are two sort of oval-shaped paired organs, one on each side of the uterus. They make hormones and they produce eggs. And the tubes actually connect the uterus to the ovaries, essentially. And the lining of the abdomen is just a thin, shiny coat that goes, all over the inside of the abdomen. The symptoms of ovarian cancer are kind of tricky, that they're really nonspecific. So what that means is everybody has one of these symptoms, at least at some point in their life. So it can be bloating, changes in bowel function, urinary frequency, pelvic pain, feeling full quicker than usual. As I said, everyone has this happen at some point, but if you have one of these symptoms that are not normal for you and they last more than 2 weeks, I consider that a symptom of ovarian cancer. So most ovarian cysts will not be cancerous. If you have an ovarian cyst, I would suggest that you see a doctor who can evaluate it further to see if it is cancerous. Cyst, by definition, is like a balloon. It's like a ball of water, and something that's a simple cyst like that, again, is rarely cancer. The risk factors for ovarian cancer include getting older, having children late or not having them at all, having a genetic mutation that predisposes you to cancer, such as BRCA1 or 2 or Lynch syndrome. There's some others as well. Having had a history of some cancers increases your risk, such as possibly breast, ovarian, colon. Additionally, being on hormone replacement therapy has been associated with increased risk of ovarian cancer. Now, people think frequently that use of infertility drugs increases your risk of ovarian cancer, but that data is really less clear. And it does, if it is associated with an increased risk of cancer, it's associated with sort of a lesser form, not what we would really call a malignancy, something that's called a low malignant potential or borderline tumor. On the flip side, factors that decrease the risk of ovarian cancer include birth control pills, which is important, having children younger, and removing parts, removing ovaries preventatively, tubes preventatively, even a hysterectomy preventatively, also getting your tubes tied. Ovarian cancer is diagnosed when a woman goes to her doctor with one of these kinds of symptoms that I mentioned before. Again, because they're nonspecific, lots of times patient might go first to a urologist or a gastroenterologist. So sometimes it involves a person going to a bunch of different doctors, but oftentimes they'll present with the symptoms such as I mentioned, and they'll get an ultrasound is the best way to look at the ovaries and tubes. And so that will be done, as well as a blood test called a CA-125 may be done as well as part of the workup and diagnosis. The actual firm diagnosis is a tissue diagnosis. So that would be based on either a biopsy or the pathology from a surgery. Ovarian cancer is generally treated at the beginning with surgery and chemotherapy in one sequence or another. Sometimes you start with surgery, sometimes you start with chemotherapy, depending on a bunch of different factors. So, and after somebody completes that frontline treatment, sometimes they will go on a maintenance therapy. It may be a pill or an infusion to sort of extend the time before the cancer comes back. A big advantage that we've had in management of ovarian cancer includes some targeted therapy that specifically sort of undoes the problem that caused the cancer in the first place, as well as a drug that blocks blood vessels from forming, which can be very effective against ovarian cancer. The good news about ovarian cancer is it does tend to be extremely sensitive to chemotherapy, especially at the beginning. The side effects from treatment can be very difficult. So chemotherapy can cause your blood counts to go down. So you can be anemic or more prone to infection or have low platelets, so more prone to bleeding. Chemotherapy very often causes fatigue. Almost every patient on chemotherapy has some degree of fatigue. One of our chemotherapies does cause hair loss. It can cause nausea. We do have much better medications now than traditionally one had for managing that, so that most patients can do okay with that. Sometimes you can get tingling in your toes and fingertips. Those are some of the side effects. There are other ones, but I would say those are the most common. For some of our other treatments, side effects might include high blood pressure or spilling protein into the urine. Talking about being at risk for ovarian cancer and wanting to have preventive surgery is a very proactive way of thinking about things. So sometimes people know they're at increased risk of ovarian cancer because based on their family history or personal history, they've gone and gotten genetic testing. And there are certain mutations which we know we can kind of quantify how much they increase the risk of ovarian cancer. And in these situations, if you do have one of those mutations, it is a very good idea to get your tubes and ovaries out preventatively, and sometimes the uterus. But I think it actually can be a life-saving measure. Now, it gets a little bit more muddy when there's not a clear mutation that somebody has. So we can't say you have a risk of, an increased risk of cancer, tenfold from the general population. Lots of times we can't say that if it looks like there's a lot of cancer in the family, but we don't have a mutation. So in that situation, it's a discussion that somebody should have with their doctor, weighing risks and benefits, because the ovaries, do have some benefits to staying in. If there's no indication that you could have a potential increased genetic risk for cancer, I wouldn't have a surgery specifically to remove your ovaries. That risk benefit doesn't make sense. One of the most proactive things a person can do is to know their family history. And if you do have a family history that has one or more people with cancer in it, it's worth discussing with your doctor, because if you have a family history or a personal history of cancer, it may be a sign that you have a genetic predisposition to cancer. If you get a test that shows you have a genetic predisposition to cancer, you can have risk-reducing surgery and literally save your life. If you think you have ovarian cancer, the first thing you should do is go see a doctor. If it seems more likely that you have ovarian cancer, it is extremely important that you see a gynecologic oncologist who is an OBGYN specially trained in the treatment of gynecologic cancers, who really takes comprehensive care. But there are data that show that people with ovarian cancer that see a gynecologic oncologist will have better outcomes. So it's extremely important to see a gynecologic oncologist if you have ovarian cancer, or if you think you have ovarian cancer.